Welcome to Pamila's Healthcare Learning Hub. Mpox, Monkeypox. Treatment, supportive care, symptom management, pain relief. Over-the-counter pain relievers like acetaminophen or ibuprofen can help manage fever and pain. Hydration, ensuring adequate fluid intake is important to prevent dehydration, especially if the patient has a fever. Wound care, keeping lesions clean and dry can help prevent secondary bacterial infections. Topical treatments may be used to soothe the skin. Rest and nutrition. Rest is crucial to support the body's immune response. A balanced diet helps maintain strength and overall health. Antiviral medications. Tecovirimat, TPOXX, and other antivirals can be used in severe cases or high-risk individuals. To date, there is no proven effective antiviral treatment for Mpox. Vaccination. Smallpox vaccines offer cross-protection and may be recommended for people exposed to the virus or in outbreak situations. Getting an Mpox vaccine can help prevent infection, pre-exposure prophylaxis. It is recommended for people at high risk of getting Mpox, especially during an outbreak. The vaccine can also be administered after a person has been in contact with someone who has Mpox, post-exposure prophylaxis. In these cases, the vaccine should be given less than 4 days after contact with someone who has Mpox. The vaccine can be given for up to 14 days if the person has not developed symptoms. Isolation. Isolation is a critical component of managing Mpox to prevent its spread and protect both patients and the community. Patient isolation. Single room. Isolate patients with suspected or confirmed Mpox in a single room with a private bathroom. If a private bathroom is not available, use a designated bathroom that is cleaned and disinfected after each use. Room ventilation. Ensure proper ventilation in the isolation room. If possible, use negative pressure rooms to minimize airborne transmission. Maintain adequate airflow and avoid recirculating air from the isolation room to other areas. Limiting contact. Visitors. Restrict visitors to essential personnel only. Educate visitors on infection control practices and provide appropriate PPE if they need to enter the isolation room. Healthcare personnel. Minimize the number of healthcare workers entering the room. Ensure that all personnel are trained in infection control procedures and proper use of PPE. Management of Mpox patients involves rigorous infection control practices, effective symptom management, patient education, psychological support, and collaboration with the healthcare team. The goal is to ensure the patient's safety, manage symptoms effectively, and prevent the spread of the virus while providing compassionate care and support. Psychological support. Emotional support. Patient well-being. Provide emotional support to the patient, as they may experience anxiety or stress related to their illness and isolation. Family support. Offer support to family members and provide information about available resources, such as counseling or support groups. Coping strategies. Stress management. Assist the patient in developing coping strategies for dealing with isolation and the psychological impact of the illness. Groups that may be at high risk of Mpox include health and care workers at risk of exposure, people in the same household or close community as someone who has Mpox, including children. Environmental cleaning and disinfection. Cleaning protocols. High-touch surfaces. Clean and disinfect frequently touched surfaces, example bed rails, doorknobs, light switches, regularly using hospital-approved disinfectants. Patient care items. Disinfect reusable patient care equipment before use on another patient. Waste management. Handling waste. Biohazard waste. Dispose of contaminated materials, such as used PPE and dressings, in biohazard waste containers. Segregation. Segregate waste according to type, sharp objects, infectious waste, and follow facility protocols for disposal. Laundry and linen handling. Handling soiled linens. Precautions. Handle soiled linens with care. Avoid shaking linens to prevent the spread of contaminants. Washing. Wash contaminated linens separately in hot water with detergent. Use appropriate laundry practices to ensure effective decontamination. Management of complications. Secondary infections. Patients with Mpox are at risk of secondary bacterial infections. Antibiotics may be used if a secondary infection develops. Severe cases. Severe cases, especially those involving complications or high-risk individuals, such as children, pregnant women, or immunocompromised patients, may require more intensive medical care and monitoring. Reason for the global emergency alert. 1. Rapid spread. The virus spread quickly in regions where it was previously rare, leading to a significant increase in cases. 2. Unusual patterns. The outbreak showed transmission patterns that were different from traditional Mpox cases, including higher of cases in non-endemic areas and among certain groups not previously affected. 3. Healthcare system strain. The rising number of cases put pressure on healthcare systems and resources in affected regions. 4. Public health concern. The spread posed risks for vulnerable populations and highlighted gaps in awareness and response strategies. Response actions. 1. Vaccination campaigns. Vaccination efforts were ramped up in affected areas, targeting high-risk populations and healthcare workers. 2. Research and development. Increased investment in research to understand the virus better and develop effective treatments and vaccines. 3. Public awareness. Monitoring and containment measures are crucial during outbreaks. Public health campaigns to educate the public about prevention, symptoms, and what to do if they suspect infection and reduce stigma associated with the disease. Reporting. Notification. Notify local and national public health authorities of confirmed or suspected Mpox cases to ensure appropriate public health response. Coordination. Work with public health officials for guidance on outbreak management and updated infection control measures. Overall approach. Treatment for Mpox generally focuses on managing symptoms and preventing complications. Antiviral medications are used selectively, particularly in severe cases or for those at high risk. Vaccination remains a key tool in preventing Mpox, especially in outbreak situations or for high-risk populations. Note: treatment protocols and recommendations may evolve as new research and data become available. It's important to consult with healthcare providers for the most current treatment options and guidelines.